CMO Parasaram. Good, good afternoon, members of the media, wider viewing and listening public of Trinidad and Tobago. You've just heard a great synopsis of our current situation with respect to COVID-19 from the Minister of Health. As you would all recognize, this situation is a very fluid and a very rapidly changing one. I think the world last night observing a decision announced by the President of the United States understands now how quickly the circumstances surrounding this can change, but more importantly, the global impact it has. So, in our current discussions that are continuously ongoing, we have taken some decisions that the Minister of Health has just announced. But there are also some precautionary measures we'd like to suggest to the population. This morning, prior to entering the Cabinet meeting, the Minister of Health, myself, the Acting Prime Minister, and I also had a conversation with the substantive Prime Minister, as did the Minister of Health in Guyana before he departed for Trinidad. We took some decisions. In dealing with COVID-19, you're going to take certain steps. So you would have been hearing us announce along the way a number of steps that are being imposed. But there are also other decisions that you take along the way before going the full ambit with certain things that you see happening in other countries around the world. One of the worst, for example, being Italy. We're now seeing what the United States are doing. A number of states in the United States are issuing states of emergency based on health issues and these types of things. So the committee, as the Minister Diyal Singh said, I have asked for a meeting with the committee at 2:30 this afternoon. As soon as we finish here, we will proceed to that. I've also called a meeting with the security personnel, the heads of security, for tomorrow morning, which I will chair, to ensure, or to satisfy myself rather, that we are in a state of preparedness for national security to provide the necessary assistance as and when this develops. And it will take a number of different formats, from being assisting with first responders to, if necessary, public order and these types of things. At this stage, the government would like to advise the people in Trinidad and Tobago of the following mantras that we strongly suggest you immediately adapt into your lifestyle and adopt. Self-discipline and self-imposed caution. Those are the mantra words that I want to resonate with our population as we go forward and as we make further announcements and pronouncements along the way. What we are suggesting is that persons do not unnecessarily expose yourself to non-essential mass gatherings. There is no need at this stage to be taking risks and to expose yourself to non-essential mass gatherings. We have not taken the step of certifying or banning or putting public order bans on any of these events. We're asking people in the first instance to exercise your own self-discipline and caution. Limit your exposure to public crowds and to public places. Take precautions that I'm sure the CMO has been repeating to us throughout, of using more sanitary measures, washing your hands, using tissues for coughs, disposing of what you've coughed on or sneezed on properly, and avoid touching your face. The next point that we're suggesting at this stage is, please consider, when it comes to travel, only engaging in essential and emergency travel at this stage. We took a decision between Cabinet last week and the Finance and General Purposes Committee meeting of this week, which was held on Monday, that from a public service point of view, the government's point of view, we are only going to authorize emergency travel at this stage for public workers. But what we're asking the population to consider, and you're seeing it happening in other jurisdictions around the world, is for now, only limit yourself to essential or emergency travel. There is no need for persons to put themselves, their families, their loved ones, and the country at risk by going outside and bringing back the COVID-19. As you heard Minister Diyal Singh say quite clearly, the first case of this will be an intrusion into our system as opposed to being already amongst us. So limit yourself to essential and emergency travel. Of course, it goes without saying that persons should remain calm and not go into unnecessary states of panic buying and purchasing and hoarding and these types of things. Of course, be precautious. We understand that people are already taking certain precautions, but it is all at this stage about self-discipline and self-control. There is very little evidence that wearing face masks by the public makes a difference. We have had a couple of instances in the Caribbean that are very close to home. I had the government of Jamaica reach out to me this morning. They saw a false report that is circulating in Jamaica of three deaths at the Port of Spain General Hospital. As you've heard the Minister of Health say, completely false. So I assured the government of Jamaica that that was not true. But it makes the point. We need people to be responsible. And in particular, we are asking for the usual help of responsible journalism from you, the members of the media. Before you all publish anything, you can seek clarification from the Ministry of Health, Ministry of Communication, National Security, and we will provide you with what are the true facts that are in place at that point in time. I am certain that by now you all would have heard of the case in Alberta. The CMO reached out to the necessary health officials in Canada, and the person who the Albertan health officials said was in Trinidad and Tobago, yes, the person was in Trinidad and Tobago, but stopped at a number of places on the way back to Canada, including that hub of Panama. When Minister Diyal Singh and I met with his technocrats 3 weeks ago, we had red flagged at that stage certain hubs. Panama is the closest international hub to us, with tens of thousands of persons coming in and then getting connecting flights and traveling out from. So this particular person went to Panama and then from Panama also to Colorado, if I remember correctly. So it was not a case that came from Trinidad and Tobago. There are instances where we are doing tracking, which we call contact tracking, for persons who have been traveling. Obviously, airlines are being affected. We have the necessary protocols in place. I'd like to take this opportunity to thank the Minister of Health, his Chief Medical Officer, and all of the staff. They have been nothing short of exemplary professionals in how we've been dealing with this situation. As he said, we have the national security apparatus in there, education, communication, all of the other facets that need to be around the table. And Minister Diyal Singh and I will be meeting with them at 2:30 this afternoon, and I will meet with the heads of security tomorrow morning. I've scheduled that meeting for, I believe, at 10:30. So at this stage, the mantras that we're asking people to consider is self-discipline, self-imposed caution. Do not unnecessarily expose yourself to non-essential mass gatherings. One example of that is the People's National Movement has taken a decision to postpone, to schedule until further notice, the walkabout that the Prime Minister had planned for this weekend. And these are the types of steps we're asking people to consider. And the public meeting thereafter. Don't unnecessarily go into mass gatherings to expose yourself at this time. And travel. We're asking persons, please reconsider your traveling plans. Only travel if it's essential or emergency travel. These are, of course, all being done as precautionary measures to delay and to protect. But you're seeing, as we sat there are cases in Cuba, a case in Guyana, 2 in Jamaica, St. Vincent and the Grenadines. So these are the cautions that we're asking you to implement immediately as of now, and we will continue to alert you as the time goes along.